Inflammation of the pericardial sac may produce a friction rub. These sounds are high-pitched and scratchy, often containing both a systolic and diastolic component. Listen to a two-component pericardial friction rub. I will start with 3 normal beats and then add the rub. Pericardial friction rubs occur when inflamed visceral and parietal pericardial surfaces rub against each other during 3 phases of the cardiac cycle, namely during atrial contraction, during ventricular systole, and during early diastolic filling. Listen once again to a two-component friction rub. Friction rubs are often heard best with the patient sitting up and leaning forward. Common causes of pericardial friction rubs include viral pericarditis, disseminated lupus, and uremic pericarditis. Listen to a patient with a two-component friction rub. The typical friction rub has 2 components, but 3-component rubs may also be heard, especially in uremic pericarditis. Listen to a 3-component friction rub. I will start with 3 normal beats and then add the rub. Pulmonic ejection murmurs can have a scratchy quality and are sometimes misinterpreted as a friction rub. However, a scratchy sound should not be considered a friction rub unless both a systolic and diastolic component are heard. Listen once again to a 2-component friction rub. Some clinicians believe that pericardial friction rubs are not heard when there is significant fluid in the pericardial sac. However, this is not true since some contact between the visceral and parietal pericardial surfaces is still possible despite large collections of fluid, as shown here. Listen to a 2-component friction rub. Transient pericardial rubs occur in acute myocardial infarction, but they are usually localized to the area of inflamed myocardium. These rubs may last only a few hours. In summary, pericardial friction rubs occur as a result of contact between inflamed pericardial surfaces. These sounds usually have 2 components and reflect motion of the heart relative to the pericardial sac. Listen once again to a 2-component pericardial friction rub. Innocent systolic murmurs are due to turbulence across the normal aortic or pulmonic valve. These murmurs peak early in systole, as shown by this phonocardiogram. Listen to a patient with an innocent systolic murmur. I will begin with 3 normal beats and then add the murmur. These murmurs are usually heard best in the second right intercostal space when they are due to turbulence across the aortic valve. Innocent systolic murmurs can also occur due to turbulence across the normal pulmonic valve. In this case, the murmur is heard best at the second left intercostal space. This transesophageal echocardiogram shows the area at the tips of the aortic leaflets where innocent systolic murmurs are thought to originate. M-mode echocardiography has demonstrated high-frequency vibrations of the aortic valve which correlate with the pitch of innocent systolic murmurs. With practice, most physicians can reliably recognize an innocent murmur by the early peaking of this murmur and the lack of any pathologic findings. In older adults, systolic ejection murmurs are often attributed to aortic sclerosis, with thickening of the aortic valve, as shown on the left. The thickened aortic valve in this setting identifies patients at increased risk of future cardiovascular events. Innocent murmurs, on the other hand, have no associated cardiovascular abnormalities, as shown by the normal aortic valve on the right. With practice, most clinicians can reliably recognize an innocent murmur by its early peaking and distinguish it from a late peaking murmur of aortic stenosis. Listen to the difference between these two murmurs. I will start with an innocent murmur, as shown by the phonocardiogram on the top, and then play an aortic stenosis murmur, as shown by the phonocardiogram on the bottom. And now aortic stenosis. In summary, innocent systolic murmurs are due to turbulence across the normal aortic or pulmonic valve. These murmurs occur in more than 50% of normal individuals and are the most common murmur heard in a general medical population. Listen once again to a patient with an innocent systolic murmur.